All right, well, why don't we go ahead and get started? So welcome, everybody. So my goal today is just to provide you with an overview of some of our current numbers, some trends that we're seeing, where we want to go in the future in the next 5 to 10 years, and where we want to focus to get there. Okay, so this slide is just kind of comparing some national trends in philanthropy versus some of the CTF trends. So overall, nationally, individual giving actually was less than 70%, but what this doesn't account for is that a lot of people are creating individual family foundations, or they're doing it through Fidelity, so it probably is still much more than 70%. Foundation giving was 19%. This number on a national level does not show both foundation and corporate, but ours does, we'll talk about in a moment. Online giving doubled to 24%. I can't believe I have a mistake in here, and that's I'm gonna tell Sarah she was supposed to get me that number. And then there's this hunger to be involved, and I think with COVID, I think a lot of you, we saw that, right? There's a younger generation also that's really interested in doing more from an advocacy perspective. A lot of people are doing things online and socially, so there's definitely a hunger to be involved and be active. CTF, our individual giving is more than 70%. Foundation and corporation is 25%. That's pretty much been steady for a while, although we are really trying to do more on that corporate and foundation level. Online giving, I'll get back to everybody on that number, but I'm pretty certain that it's increased. I just don't know if it's 24% or what the percentage of donations that are coming in, which are online versus other. I know that through Walk and other events that we have, we're taking advantage of some mobile technology. We're trying to do text to donate and using app technology, et cetera. And of course, everybody does more and more online. And if we can capitalize on that younger generation through Cupids and other events, we are going to see that continue to grow. And then we, of course, know that where nationally there's a hunger to be involved on a CTF side, there's without a doubt the hunger to end NF. And you can just see that in the room here. You can see it in the plenary sessions in the evenings, like people want to end NF. And I think Paul Racy's mantra, believe, 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 I've heard it a number of times today already, and certainly we can believe that we can end NF. So I was reading something and this struck me, this dancing with our donors, right? And that's really a lot of what I'm going to be talking about. Those of you who were in Pam Swank's session yesterday heard her talking about, the power of stewardship and gratitude, really, right? And that's really what I think I focus on, and what I hope we all focus on, which is really about listening to our donors, really listening to what they're saying, listening to the volunteers, cultivating them, storing them, thanking them, this whole effort and belief in gratitude. And I think we as individuals, as an organization, in order for us to really grow, and you'll see where we want to be in the next 5-10 years, we have to be resilient and we have to be adaptable. And I think COVID showed that we could do that. I'll show you our numbers in the next slide over the last few years. You'll see they kind of go up and down, but there is a steady trend for growth. Okay, so this slide is our last 5 years. So the blue line is unrestricted revenue, and I'll talk about why that's important. The green line is overall revenue, and then the purple line is expense. So you can see over the last 5 years, our revenue has really grown. I mean, that's pretty significant at the end of the day, particularly if you look at between 2017 and 2019. And we'll talk in a minute about some of the trends and why we grew, particularly in 2019 and 2021. But the other thing that's really important is the blue line, and you're seeing that grow, and that's the unrestricted revenue. The restricted revenue is really important from a perspective of funding mission and funding specific mission projects, but unrestricted is almost even more important. And that's where all of you come in with your fundraising, because the more unrestricted revenue we have, the more cash we have for a rainy day to able to put towards a bigger project, and we don't have to restrict that specifically. Okay, so key growth factors. So over the last 5 years, our overall revenue increased by about 64%, unrestricted revenue by 25%. So the fact that we're growing, that's huge. That's really, really huge, particularly with COVID, which did hurt us, and it did impact revenue. But of course, we didn't spend that much money. So we actually ended up with net revenue much higher than normal. And I remember saying this, I remember very distinctly when COVID hit, having a development team meeting and saying, it doesn't matter what you do. If all you do this year is just cultivate and steward and build relationships, the revenue is going to come, and it doesn't matter if it comes this year. That's not what's going to be important. Let's use our time wisely. And I think that we really did that, right? And our revenue wasn't hit tremendously. There were certain revenue lines that were hit, but everybody worked so hard, and everybody was resilient and adaptable and made things work, became virtual, did hybrid. It was really great to see everybody doing that together, both on the staff side, but also on the volunteer side. So in 2019 and 2021, we did show tremendous growth. In 2019, we launched the Discovery Fund. Well, we officially launched the Discovery Fund, and we were able to raise $8.6 million in committed dollars specifically for that, and that was very mission driven. That was all restricted, a lot of that was restricted revenue, but that really gave us an influx of money to put into research. And then in 2021, you saw an increase as well, and we did have one-time $1 million gift that came in, but Cupids became a part of our family again, and that really brought us an influx, and that's going to continue to grow. And I think that as you see Cupids and Walkas growing and peer-to-peer and our gala and major gifts, all of this is really going to have an impact on what we're able to do, and that's because of each and every one of you. A few years ago, we did realign fundraising, and I think that helped. I think that really allowed us to be able to focus more and be able to focus on stewardship and cultivation, which I would risk my entire career on stewardship and cultivation, because I really think that those two things are the most important things that we can be doing and really showing the impact of the donor dollar. Okay, so where do we want to be in the next 5-10 years? All right, so this might be a little scary for some people in the room, but I think we can believe that it's possible. So the board and we're going through a strategic planning process to look at what the vision is. Our vision stays the same, right? Our vision is to end NF. The question is, how can we be more focused in actually getting there, right? So we're looking at what those strategies are, and then we have to say, how much money do we need to actually make that vision of ending NF a reality? So the board's kind of come up with this vision number of 50 million in 10 years. Wouldn't it be great if we could be a $50 million organization in 10 years? Now, we're probably going to have to be adaptable and flexible and look at different revenue models in order to get there. But I did some math, and I was like, all right, what if we did 15% growth? And those staff in the room who know me know that every year the budget comes around, I'm like, 20% growth, guys, let's see, can we do it? Can we do it? And you know, in some cases we can, in some cases we can't, but 20% year over year is really hard. So I looked at 15% growth, which would put us about 60 million. 10% growth gets us at 40 million. But if we can figure out like between 10 and 15, like 12% growth, probably would be our sweet spot, right? So then we would be over 50 million in 10 years if we could consistently see a 12% growth on our numbers year over year over year. So you're all probably like, oh my God, how in the world are we going to do that? But again, I think this culture of stewardship and cultivation and listening to our donors and leaning into them and leaning into all of you in the room, our volunteers who are making this happen, that's how we're going to get there. The power of our community. There we go. Can you advance to the next slide, please? All right. All right, so again, how we're going to get there. So this is that cycle of philanthropy. It's the power of stewardship. We all need to be good stewards of your dollar, of the dollar that you're giving us. The fact that you've given a dollar, the fact that you've raised a dollar, you own a lot of the research that's being talked about. And I hope you'll shout that from the rooftops. But we also need to make sure that we're communicating your impact and letting you know how we're stewarding your dollar. Cultivation, when you're building a relationship, whether it's somebody that we're already working with or with a new prospect, that's really important. And again, I was thinking about Pam Swank's presentation yesterday, right? When you meet somebody, you know, and with communication, telling them your elevator pitch, telling them your story, telling them a little bit about why CTF is so important to you. And listening, like we can all be listening to our volunteers and our donors and others, the people who are coming to our events, just to understand what are they looking for? What can we do for them? And then, of course, we need to identify new donors and volunteers in order to grow, because we want to grow this community. There's so much love, and we want to make sure that we can fund the mission of the organization to end NF. Next slide, please. Okay, so I'm going to talk a little bit about a few of these ways that we're going to get there. First, I thought, let's talk about how do we identify new donors and identify and diversify a base. And so this is a little bit of what we're doing now and a little bit about what we need to do more of. So prospect research is really important. And I think, all of you who do events are saying, well, how do we get new people to the walk? How do we get new people here? Well, we can sit down, we can have a conversation about that. There may be people who are we'll pick on Chicago for a second. There may be people in the Chicagoland area that we haven't been talking to, right? Doing cultivation events in the Chicagoland area, in the New York area, in the Connecticut area, in wherever in the Denver area. Let's think about that. That may bring some people in where we can talk about what we do in the community. We need to do more donor segmentation to really be looking at who do we need to be cultivating. And I'll talk a little bit about that momentarily when I show you some stats on where we are trying to focus more and more as an organization. Cupids is a great example of diversifying our base, right? We're bringing in new donors, new people, even though the average age of the Cupids event director may not be the age of Sean Hackett sitting right here. It might be a little bit older, but it's still the ability to bring in new people, and it's a great opportunity to talk about the impact to somebody who is not affected, right? And how do we get them more engaged? How do we get more Sean Hacketts in the room with us? We're certainly doing more on the corporate and foundation level. As I mentioned, that's about 25% of our revenue, and we certainly want to see that grow. We have somebody who's specifically working on corporate and foundation, and we are expanding. We're looking at, Walmart's giving us some funding. Wawa, we just applied for a huge grant from Wawa. We're looking at the Walton Family Foundation, Morgan Stanley. Where are places where we know they focus on health or children that we could actually get in and actually see if we can get them to give us some funding? And again, we need your help on that too, because you may know somebody who works at Morgan Stanley, or you may know the manager of your Walmart, and they give out $10,000 grants on a local level. And maybe that's a way that we can get some diversification and new revenue in as well. The junior board has been huge. That's been raising new money for the last 2.5 years, and it's bringing in that younger generation and bringing their friends in. So it's both affected and unaffected. I mentioned yesterday in one of the conversations, one of the talks about local advisory boards. It's another great way we're trying to diversify, trying to grow the base in the community. Connie and Kim work with me on that hand in hand. Event expansion, right? Dancing with our stars. I don't know if Leslie's in the room, but we're trying to look at that and say that could be our next big campaign. For those of you who are familiar with Leukemia and Lymphoma Society, they're all about expanding their campaigns to the next level. And they took something called Man Woman of the Year and made it a $10-20 million program for them. And they've created Student of the Year, which is like a $5 to $10 million program for the year. So if we take Dancing with Our Stars and model it in different communities, that's a great way to get new people who are interested and involved. We love this. So right now we're in Northwest Arkansas, which is going to help us bring in new corporate donors, bring in new people to the organization. So that's all about diversification. We're doing more disease-specific meetups. If you haven't heard about them, let myself know, let Connie know. European expansion. We actually just got €100,000 commitment from a donor who'd been giving to the US at about $1,000. And we started to cultivate him, and he randomly met Annette, and we said, oh my gosh, and I think Connie might have found him and said, oh my gosh, we need to connect with this person, and we did. And we've been connecting him with some of the staff, with Salvo, talking to him about what we're doing in Europe and in the US, and he's come back and he's given us a multi-year commitment of €100,000, and that was completely unexpected at the end of the day, and that just came in this year. So that's all about expansion and diversification. Working with our NF clinics, it will help us build our base from a perspective of the community, but also the patients and the medical professionals. And I love seeing the mix. And I can tell you, having dinner with some of the researchers last night, they love being here. They love being with all of you and being able to see in reality what their research is doing and talking with all of you. It really makes it human. It's that head and that heart. Okay, next slide. So cultivation and stewardship, I will say it and say it again and again and again, but this is really probably one of the most important things that we do. So I think what I wanted to let you all know is what we as an organization are trying to do more cultivation and stewardship. And I'm going to show you why it works in the next few slides. So what we're really trying to do is focus on, we need to cultivate more of our major donors. Our major donors are 5,000 plus. We have to be looking at how do we get more $500,000 donors, which would be principal giving, which would really help get that 50 million sooner. Blue and green circle. So this is our ability to steward all of you who are either giving or raising $1,000 or more. It was created by two of our staff, Connie and Allison, and it's our ability to be able to say, we want to give you access to researchers. We want to give you access to Annette. We want to give you access to programs like we had on Thursday evening and make you feel like you are important and special, because you are important and special to us. The one thing we could be doing a lot better of, and I'm happy and delighted to hear feedback in terms of what we could do more of for you in the community to let you know about the impact of your dollar. But we are trying to do that with some enhanced donor communications, and I will, there's a great story here, is that we sent out a letter from Annette. It was an email about the impact of your donation, and we sent it to, I think it was 5,000 and above donors. And we had one donor who was so moved, they asked their family to give because of the letter, forwarded it to them and said, please give to the organization. But we also had another donor who came to us anonymously because of that and said, I want to be anonymous and I'm giving you a $1 million gift. So communicating the impact works. And I think we're hearing a lot more this conference about communicating the mission and making sure we have that elevator pitch and that story, because you never know who may turn around, who's giving you $50 or $100 or $250, who's going to say, you know what, you've really moved me and I want to give you more, and tell me how I can do that. We're focusing a lot on our 1,000 plus donors, and in a few slides I'm going to show you some data and some statistics. That's going to show you why, and it's also going to show you why stewardship actually works. So we're also trying to do a little bit more on our what we call moves management, which is taking somebody who's been giving for a long time and creating a plan so we can move them to the next level. And hopefully you all have benefited from the virtual receptions that we've been doing ever since COVID hit. We couldn't get to everybody. We can't do this all the time. And even now we find that some donors don't actually want to meet in person. They prefer to actually just say, you know what, I'm a little cautious with everything still happening. Can we just meet via Zoom? And I can tell you, I think that it's actually really enhanced our ability to cultivate and steward a lot of people by being able to just say, hey, do you have a half an hour to jump on a Zoom? And we can talk about the research that's being done. But we've had a lot more virtual receptions, and last year we saw about a 15% increase in our major donors, and I think that is because we did a lot from a perspective of virtually, and we were able to meet people who weren't going to come to a walk or didn't live in an area where there was one. And so, you know what, this is an ability to give them the information on how their dollar is impacting the vision and the mission of the organization. Next slide, please. So this was some advice that was given to me by one of my mentors who, other than Pam, there's two other people in this world who I think are two of the best leaders and fundraisers outside of Annette as well. And one of them is a woman by the name of Myra Biblewit, who actually does have a close connection to somebody who has whose son has NF2. And I sat down with her over lunch and I said, what advice can you give me? And she said, if you don't ask, you don't get. And that has, that is so true. And it doesn't matter if it's asking for $5, if it's asking for a raffle, or if it's asking for an in-kind gift. If we don't ask, we're not going to get it. And if you ask at a higher level, that's okay too, because our vision is to get to 50 million. And if you say to somebody, we really want to end NF, we really want to become this life-saving $50 million organization, can you help me get there? They're probably going to say, yeah, tell me how I can do that. Next slide. Okay, so one of the things that we're really trying to do is focusing on individual donors. Now, most of our revenue comes in through individual donors, and that's donors who are coming in through events, and also donors who are giving to what we call the annual fund, or just general giving. And I'm going to focus a number of slides that are coming up and some data I'm going to show you specifically on the annual giving, so you can see some of the trends that we're seeing and why stewardship actually works. Next slide. So these next two slides actually are going to show you the graph of our individual giving. This first one is just those who are giving to the general fund. The second one shows all individual donors. Those are people who are giving to all different types of events across the organization. The actual interesting thing is that the trend actually is exactly the same. The numbers are a little higher on the second slide, but the trend is that we're seeing growth. You can actually see 2019 and 2021. It's that same pattern. We actually raised that 8.6 million in 2019 for the Discovery Fund, and then in 2021, Cupids became a part of us again. So you'll see that those are why we're increasing so much. But in general, we're actually seeing an increase in donors who are giving at this level, and not only once, but sometimes twice. So this is the all individual giving slide. So you can see it's almost exactly the same. Sorry, did I go? Yep. So you can see it's almost the same, but the revenue is higher because we're looking at all individuals who are giving. Next slide. All right, so these next two slides are just I've highlighted some data here. This is something that our board is asking for, and we want to be looking at this. This is really important to us. If we're going to get to 50 million, we need to be able to better understand who's giving and why, and at what levels we really need to be focusing on from a perspective of overall cultivation and stewardship. So this is just focusing on non-campaign donors. So this is just people who are giving to the annual fund. Now, some of these donors are giving to campaign, but they're also giving to an annual fund. And for definition's sake, campaign is what we consider a peer-to-peer campaign. So that would be, say, a walk or a run or Cupids, something of that sort. But a lot of those folks are affected. So they're not just giving to the campaign, they're also giving again to the annual fund, and that could be through an appeal, et cetera. But what I think is really, really interesting is that you can see that our numbers between 2020 and 2021, and this slide is year over year between 2020 and 2021. The next slide is going to show you the first half of this year compared to the first half of last year. But in both of those slides, you're going to see that our numbers are increasing in a lot of areas, particularly when you look at that 1,000, 10,000, the 25 to 50 in the year over year was relatively stable, but we're increasing those 1,000 plus donors. And what I find very interesting about this also is that we look at non-campaign donors, that's over 50% of our revenue is coming in. So that's also something to say, we need to be focusing more on these individual donors who are maybe giving to campaign, who are also giving, who may be able to give more at the end of the day. How do we get to them? How do we talk to them? How do we work with each of you who may know them and maybe the reason they're giving to the organization to actually talk about the impact that they're making for us? And our donor retention, that's something we probably need to work on. And we need help with all of you to be able to make that happen so that we can get repeat donors who come back and move them up from 1,000 to 5,000, 5,000 to 10, et cetera. One other thing that I just want to mention, something that I know that staff, our development team really works hard on, is doing these touch points. And for us, a touch point is making an individual call or sending a personal letter. And we do that for anybody who's giving at $500 and above, but we also do it for people who are giving at a lower level if we know them, if they are somebody who one of you have brought to the table, or we're working with you. And I'm looking at you, Danielle, because I know that our staff has come to you to say, you're doing this wonderful birthday fundraiser for your son. How would you like us to steward your donors? Do you want us to thank them? Do you want to thank them? And so we try to really partner. And we've talked a lot about that staff volunteer partnership, which is also really the crux of stewardship and how we're going to move the needle and go from 17 million to 20 million to 25 million to 50 million at the end of the day. But what I think is really important here, if you look at this slide, in 2020, now granted we only did $1,000 and above, but look at the increase in touch points that we had. That's just huge. And that's why I really do think stewardship works, because we're trying to let all of our donors know and all of our volunteers know and people who are giving to you that we appreciate, we are so grateful for what they do for us. Next slide, please. So this is that same exact slide, but just looking at the first half of the year, January 1 to May 31, between 2021 and 2022, because we want to start doing some more data analytics. So I know this is not the most interesting, it's all numbers and it's all data, but if we're not looking at data, then we're not going to know what the trends are, we're not going to know where to focus, we're not going to know how to really move this organization to the next level. But my takeaways here are stewardship works. Again, the 1,000 plus donors are raising close to, this is 50% of the revenue in just the first half of the year. We talked about that $1 million gift by the anonymous donor inspired by Annette's investor letter. The donor, the $50,000 donor, who asked her family to give, and that resulted in another $100,000. And then we also received a pledge this year. And a lot of that is about stewardship, and I'm going to do a few case studies in a moment as well. But again, you can see that 1 to 10 is increasing. That 10 to 25 is increasing, plus we have new gifts in there. There may be some times where we have a one-time gift, then our opportunity is to say, okay, how do we make that person a lifelong donor? How do we steward that person? What do they need to know from us so that we can get them to come back? How do we build that relationship so they give again year after year after year after year? And again, you can see that our touch points also increased. So last year, this half of the year, we only had 148. This year we had 503. What's also very interesting about that is last year at this time, we had already had 1 or 2 additional events that didn't happen this year or happening later in the year. Next slide. All right, so I'm just gonna go through a few donor case studies. Now what I realize is these are people who are giving at a high level, but I think what's really important, let me go to the first one, is that they didn't necessarily always start out at that high level. So this first case study is someone who has a family member, has 2 family members with NF1. Over the years, since 2009, they have been giving specifically to what we now call the Discovery Fund, just giving to general research, basic science. And then over the years, and obviously this relationship has been stewarded by more than just the current staff, as previous staff as well. But this last year, through stewardship and through providing them with regular touch points and updates in terms of where their dollar is going and providing them with access to whether it's the researcher that they're funding or whether it's Salvo or Annette, this donor has gone from $10,000 in 2009 to $500,000 in 2022. 2021, and the last commitment this year was $750,000. So that's pretty incredible, right? We're obviously taking this donor and talking to them and saying, we need your support. We want to tell you where your dollar is going, what the impact it has had. And what I loved when I remember having this conversation with Salvo, myself, and Peggy Wallace, some of you may know her. She is an incredible researcher, helped to discover the NF1 gene. And she's also leading our gene therapy program and sort of overseeing that. And this donor said to us, where else am I going to put my money? Where else am I going to invest it? I have a house, I have a business, I have a car. What else am I going to do? This is what I want. I want to help you end NF. And I just was so moved by that, right? I wish everybody would be able to say that. Next slide, please. So this is the anonymous donor, which I've already sort of talked about. They gave a yearly major gift, has NF2 in their family, but we were cultivating them year over year over year and very, very little response. And I think that's something that's really important also. Oh, next slide, please. So it's really important also, you need to listen, but you also don't give up, right? Just because you don't hear from somebody, or you're talking to them, or you've made an ask. Again, Pam Swank, if you were in that session yesterday, she talked about her best friend who never gave, and they've been friends since high school, and her best friend's father had died of the disease that Pam was working with at that moment in time. And it was years later where her friend finally said, I should get involved, I should give, right? But it didn't stop Pam from not asking or asking her friend to do things. And I think that's really important. In this particular family, there was radio silence for years and years and years and years. And because we've kept them apprised of what's going on, because we've given them the information on the impact of their dollar and where it's going, we've given them the impact of NF2, what we're doing, how we're increasing our efforts there, that they've become moved to do more. Next slide, please. So this last one, if Leslie was here, I would ask her to actually talk about it. So this one I love. So this was a first-time dancer for Dancing with Our Stars, Little Rock. She knew nothing about CTF through cultivation of a former dancer. And again, this is why like cultivating people year after year is really important and getting them engaged and involved. So this woman loved to dance. And so she said, sure, I'll do it. Sure, I'll be a dancer. She loves the limelight, loves to be on stage. So she came and she had so much fun, but she was also so moved by the mission that we wanted to cultivate her. Now, granted, she has connections in the community, right? But it wouldn't matter if she was connected and she was committed and she wanted to learn more and she wanted to do more. So we took her out for coffee and we talked about the organization and how she can get more involved and a few ideas we had for her. And lo and behold, she's agreed not only to chair Dancing with Our Stars Little Rock, she decided to chair the campaign for us to raise money in Little Rock for an adult clinic, which is a pilot program that we're doing, and we need to raise $500,000 over 2 years. And she made a $50,000 commitment to that campaign on top of her overall support for Dancing with Our Stars. So this is a great story of somebody who's unaffected, said, oh my God, I really love what we're doing. I love this organization, and cultivation and providing her with more information has actually increased her commitment to the organization, hopefully for the long time. And Amy can attest to this because she's been on many, many calls with this particular donor as well. And this is the staff and volunteer partnership, right? So Leslie and I do a lot of tag teaming when we sit down and meet with donors, and I think that's really important. If you and Stacy, we just talked about this too, right? So use your staff partner, tell them, I want you to come up to Connecticut, or I want you to meet this person in Chicago. Can you come in? Can you fly in? Or you're here now, can you help us? That's really important. And that's what we want to be doing. We want to be out there in the community with all of you, meeting people, taking people for coffee, for lunch, et cetera, building these lifelong donors and these sustainable relationships. Next slide, please. So my key takeaways specifically about how we're going to move this organization to the next level is really, again, it's stewardship, it's cultivation with each and every one of you, with the people who are giving to you, to our 1,000 plus donors. That's how we're going to move this organization to the next level. Stewardship and gratitude works. It really, really does work. Don't take no response or no for an answer. No is generally just a no, not right now, or no, I can't give at that level, or no, I've got other things going on. But it's unless somebody really says, no, I'm never giving to this organization, don't ever take no or no response as an answer. It's just, we all have a lot of stuff going on. And I think that it takes a while. And in a lot of cases, I could give you 3 or 4 more case studies. There's one donor that we've been working with who she's NF1 in her family. They gave a huge amount to their clinic. In fact, they started the clinic up in Toronto. Their family gave, I think, 11 million recently, maybe not all in one chunk, but it was 11 million commitment. So we've been working with her for 3-4 years. It took me 3 years to get her to commit to a multi-year gift with CTF, but we did it. And that's because we just talked to her, told her what we were doing, invited her, said, you're in New York, come for lunch, et cetera. And we've become friendly, and she and her husband are giving, and hopefully will continue to give more and more and more. Again, that culture of stewardship, to me, that's why we're seeing an increase in giving overall and an increase in our overall donors. And that's it. Next slide. So questions, any questions for me? I know we have a lot of staff here too, so any questions for the staff? Stacy.
I definitely think that all the handwritten notes and the calls are extremely effective. I know from donors that we've had for our walk team they'll let me know, oh my gosh, I got this phone call or I got this lovely note, and it's a wonderful, wonderful touch. And so I think that that should continue. I think it's a great idea. My biggest question is when you talk about working with the NF clinics, I see that as a place where we can explode with more participants in events, in walks, and that then spreads to all of their connections, all of their communities, all of their networks. And at least in Chicago, we're still struggling with how do we get those families their information to us. And so I don't know if anybody in other communities are finding ways to make that really work effectively. But I feel like we'll be unstoppable if we can kind of clue into that.
Yeah, I totally agree with you. Before I kind of answer that, is there, okay, so you're right, and I it's hard, and I put that in there because that's been one of our strategies for diversification on the volunteer side. I can see Rebecca shaking her head back there as well. Connie, I know we've been like, we were poised to do this, and then COVID hit, and then it was like, oh, the hospitals have now different regulations, or you have like it's difficult. Leslie, I will say Leslie Oslisa does this very well. The folks in Denver do it very well. But I think the key, so those are people who you should absolutely talk to about how they do it. They also have a really good partnerships and relationships with their clinicians. So in Leslie's case, she has this local advisory board. So Dr. Kevin Bielamovitz, who actually, I don't know if he's still here, but he presented, he's actually on the advisory board, right? And then, and you guys have great relationships with Bob Listernick, right? So if we ever thought about it, we'd say, okay, is Chicago an area where we should build a local leadership board, and let's get Bob or one of the other clinicians onto this little advisory group to talk about, all right, how do we expand? What do we need to do? We've got the walk, are there other programs that we want to bring into the community, right? Because I think that's key too, is diversification in our local area of different events and different things that we can offer, right? And I think that's worth having that strategic conversation with a few staff partners to say, what can we do? Walk is huge and amazing. And I look at the two of you, and I say, okay, you guys have actually grown it. I remember a few years ago having this conversation about the clinics and not having, having you guys be the two families, and now we've grown that, right? And we've been able to see that. Now, if we could get more in the clinic, that would really help us there. So I think it could also just be sitting down with Heather and Dr. Lister, with Bob, and saying, what can we do? How can we do more? And I know it's not just, there's Lurie, but there's also another hospital as well that we need to kind of crack through. One of the things we're also trying to do in the Boston community is actually partner. So Sharon Klein, who is here this weekend, she runs NF Northeast. So, and it just so happens that I used to work with her, a few of us used to work with her at Leukemia and Lymphoma Society, but we also have a small group in Boston that does one event and that's it. And we're trying to say, what else? We're kind of tired of doing that event year after year. What else can we do? So one of the things that we're looking to do in Boston is actually host small cultivation events to create lifetime donors. So can we take some of these donors who've been giving to the event, and maybe you don't do the event, maybe you just get them to give. And that's what we're trying to do there. But at the same time, saying we need to diversify our base in Boston because our lead volunteer is 82 years old, right? And she might not want to do this for another 10 years. And granted, I don't think she's going to go anywhere till she's about 100, but so what we're looking to do is say, can we collaborate with NF Northeast, and what can we do? And they actually do work in the clinics. And so we're going to start partnering with them and jointly do tables in some of the hospitals. They're going to help fund research. Right now, granted, it would also, like, if we can start to find ways to partner with some of the other local community organizations, easier said than done, I know that. But there's probably a strategic way that we can take a look at doing that. I don't know if I truly answered your question, other than say, we've got to believe, and we've got to make sure that we can only try and try again and continue to try again. And that again goes back to the cultivation and stewardship. The medical community didn't even talk about them here, but that's another group of diversification and storing and cultivating. And perhaps some of those other community organizations, if we could find a way to crack that code.
So yes, it did. It's on. When you were talking about sending letters from CTF, with our Little Heroes 5K, you know, a lot of stuff, we send big checks to you. Obviously, we don't expect a letter because we know that you appreciate what we're doing. But when our donors send a direct check to CTF for Little Heroes 5K, are they then receiving something from CTF?
So that would be, so I know in your instance as well, that would be working with Emily and saying, so Emily should be reaching out to you saying, we're getting all these checks. Do you want to thank your donors personally, or would you like us to send touch points to all of them or a few of them? So
I was just thinking it would be even more effective if we're sending our, regular email, but also we might get some personal donations on top of their corporate donations just as a result of saying, oh, this is something our family might like to give to, and they just give it into the general fund on top of their corporate donation.
Yeah, absolutely.
Okay.
Right, and that's why, again, we can change that. That's easy. We'd love to do it.
It's like our $10,000 sponsor. He knows Robert personally,
Yeah.
but his corporate sponsorship is what we're receiving. But if he's getting literature and stuff from CTF, then he might be willing to donate on a personal level.
All right. Well, we're going to take that one up right after this. I'm going to find Emily and say, Emily, guess what?
Okay. Apparently, I just gave you some more work.
I was interested in about the discussion kind of taking your donors that are in a certain level and kind of converting them up to the next level, and what advice you might have for us who, for example, in our fundraiser, we have between like 50 and 70 donors, and they're generally at like a small number individually. But if we can convert our 25s to 50s or our 50s to 100, and if you have suggestions on how to do that from the CTF side, one thing that comes to mind are, maybe like a hunger campaign or something that's like your $25 gift buys this and your $100, buys a goat, and your, those types of analogies for people. But anyways, interested in kind of your thoughts on that.
So we don't have the, we don't have the ability to do the, if you take your $25, if you make a $50 donation, it will go here, right? We don't have that specific. I think we've tried to do that. We can do it, I think, at a little bit of the larger level, but I think that's actually really simple. And some ideas I would have for you and for others in the room too is maybe there's a way that we can actually just do some sort of, whether it's in person or virtual, get together with some of your donors and to say, we want to let you know where the impact is. And we can do that. We can have Salvo be in person or on a Zoom to talk about the impact. And to me, that's the first thing that should happen, or an additional thing that should happen, so that they are actually getting more engagement with the organization. And then as we build out the campaign for next year, we can say, let's take 10 people who we want to increase the gift, and then work with your staff partner to say, how do I do this? And or even the staff can call and say, we wanted to thank you on behalf of the Bonadis family. You're doing so much, and we're hoping that this year that you might increase your gift. Or we can do a special campaign around, you can do a special campaign and say, we want you to support, this year funding is going to support the Discovery Fund, which is, general research overall. And that, and you can say in your letter and your appeal, I hope that you'll consider to increase your gift this year because it would mean so much to me and my family. Simple things like that. It also sort of takes, because sometimes I know that we didn't do a whole session on the art of the ask this time around, but that is one of the hardest things to do. And I think Pam said it yesterday, which is most of the time you're not, like if you're cultivating and stewarding, that moment in time comes, a lot of cases you don't even need to ask. Sometimes they'll just say, I want to give, if we're doing our storytelling right and communicating the impact of our our funds right. But those are some simple things that we could think about doing for you.
Just real quick, Michelle, I was going to also suggest those great little impact nuggets that you send around to the team.
Yeah.
We can share those with
That's
them
great.
to share with their donors, because
That's a great
sometimes they
idea.
want to hear directly from
great.
the person
It's a great
they're
idea,
investing
Connie.
in.
It's a great idea. All right, are we standing between, is lunch in this room? All right, so I thank you all. I hope you enjoyed it. I hope it was impactful and interesting. I really appreciate being able to present it, so.